It is your social, economic, physical, spiritual, and mental well being. Just imagine you on 88.5 Super FM talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure,
It's 8.5 Super FM. It is now 50 minutes past the hour of 10 a.m. Good morning, listeners. Good morning and welcome inside another edition of Casualty 911. I am Lencia Mathra and joining us in studio today is Miss Louisa Wilson and she is joined by two guests who will introduce themselves. Good morning, ladies, and welcome inside Casualty 911.
Morning, Alicia. Fawn, are you hearing us?
Yes, I can. Good morning.
Fawn, how are you?
I'm good, thanks.
Wonderful. Ulan is there today.
I saw the
Ulan,
Yeah, I'm
say
here.
hello to Fawn.
Hi, good morning, Fawn.
Good morning, Erlan.
I,
It's
I, I,
good
I
to be
think that
back. Good to be with you again.
yeah, I was MIA for just 1 week. I'm back.
Okay, great.
So, Fawn, can you start us, please?
Okay, good morning to our listeners. It's wonderful to be back. On last week's program, we mentioned that it's Diabetes and Awareness Month, and we will be highlighting some of the services that are available for diabetes patients and also for people who may just want to have a check every now and then. This year, the theme for Diabetes Awareness Month is access to diabetes care. If not now, when? So, when we speak about access, there are several issues that we could consider. So, for example, we could take into account what services are available. And when we speak about the services, we need to know what they are, whether the quality of the services, whether the quality is good, location. Can the people who need can the people who need the service actually get to the place without too much expense? Cost is a factor that we have to take into consideration. Are there enough services available? Can the services available make a difference in terms of management of the condition? Is there access to medication? Is there access to information? So we are going to try to bridge some of those gaps during the month of November. We started last week, and today we are going to highlight one of the services that is available at all of our wellness centers. Some of you may not be aware of it, but hopefully by the end of today's program, you will have a good sense of what that service is about and how you can go about accessing it, how it can help you. Now, regular and reliable access to care is very important within the health service, and particularly the public health service, because we know that the public health service tends to, you know, give coverage to a lot more people. So whereas everybody may not be able to afford private medical care, may not be able to go to a private doctor, the public health service provides services that all of us can access either free of charge or at a very low cost to us. And sometimes we tend to think that, oh, because something is free, it's not that good. But within the public health service, we have programs that are of very high quality, and we need to take advantage of those programs in order to help us. Because taking advantage of services like what those that are available in terms of diabetes care can help to either delay complications of diabetes or prevent complications. So we need to start to figure out whether we are really serious, because remember, as I said last week, managing our condition well is very dependent on us. So whereas we may think that the doctor or the nurse is responsible, we have a very, very important and large role to play in terms of how we manage our diabetes and to manage it well. So today we are going to be providing information so that you can access one of those services. Making use of those services can also help to increase your quality of life. So think about it. If you're living with diabetes and you access those services and you make use of the information and the skills that you receive from those services, it could very well help you to avoid blindness or to delay the onset of blindness, to take better care of yourself in such a way that you may not end up with an amputation. So all of these things, all of these complications are things that we see in St. Lucia quite often as it relates to people living with diabetes. So without further ado, I'm going to invite Louisa to introduce our guest and give us a brief summary of what our guest will be speaking about, some of the information she will be sharing with us today. Welcome to our guest. I will allow Louisa to say your name. You're no stranger, and we're happy to have you back.
Good morning, Alice, to all our listeners. I must admit, Polly, I don't know, I was a little bit taken aback. So this morning I'm going to introduce our guest. She has been on the radio program with us before, and she is one that is quite knowledgeable in her field, and we're hoping that we can utilize her in more programs to come. She is Mrs. Campbell, so Fadia Karen Campbell. All right. So Fadia's working life has been spent in various capacities within the Ministry of Health in St. Lucia since 1993. She first started working as a community health aide at the Marbush Health Center in Choiseul. There she gained a wealth of knowledge and experience in clinical care and community home health practice for 5 years. She has been a nutritionist for the past 11 years, wow, in the Ministry of Health and Wellness in St. Lucia. A passion for the field of nutrition and service to the people propelled her to pursue a career in the field of nutrition, and most recently, a master's in public health when she was awarded a scholarship by the 10th European Union Scholarship Program in St. Lucia. The high prevalence of chronic non-communicable disease in the region and globally, by extension, is a public health concern. Working in the community, primarily in primary healthcare settings, has afforded Fadia the opportunity to experience firsthand the detrimental effects these diseases as diabetes, hypertension, heart disease, cancer, and their comorbidities have on patients who poorly manage these conditions. Her role as a nutritionist is to provide nutritional guidance and support, and to empower people to make healthier dietary choices through counseling, menu planning, nutrition education, and health promotion. Her role also allows her to assist the chief nutritionist and other members of the health team in the development and monitoring of public health nutrition policies, protocols, standards, and procedures. Fadia is always excited at every opportunity to pass on knowledge and education to the general population in making healthier lifestyle choices through choice of healthy foods, regular physical activity and exercise, good quality sleep, and positive meditation. So, Fadia, we welcome you. It's always a pleasure to have you on the radio program. I need to say no more because based on everything that I have said, I know for a fact that your wealth of knowledge has impacted many of us and will continue impacting the general public. So without any further ado, I'll let you speak about why you're here today to guide us through the process. It's okay. So Fadia, go on.
Okay, good morning to everyone. Thank you so very much, Louisa, for this introduction. And today, I just want to speak about, like Fawn alluded to earlier, the service that we provide as it relates to the nutritional services within the public health arena, and that is the wellness centers. I work within the Region 5, that is the Beaufort area, but when I'm called upon to work in any other health region, I gladly take on that sort of responsibility. So today we will talk about, a walk through the process of intervention for recently diagnosed patients with diabetes. And we know that in St. Lucia, the prevalence of diabetes is high. That's almost 15%. So when you speak about out of every 100 persons in St. Lucia, about 15 of them are diagnosed with diabetes. And we're not even quite sure of that number, of recent, because some persons may not come in as soon as they are diagnosed, or they may have symptoms, presenting symptoms, and they may not necessarily go for a checkup. And the only way that it can be confirmed that a person has diabetes is by doing the laboratory tests. Okay, so this is a high number for a small population, about 180,000 in St. Lucia. Now, when somebody is diagnosed or the doctor tells you that you have diabetes, a number of things can happen to that individual. There can be that level of what we call denial. Some persons might say, how is me or not me? I don't think so. And a number of things can come into play as a result of that. Some persons may accept it at some point, and some persons may just flow with it. So when it comes to the point of nutrition, which is very, very important, which is part of the process of helping a person being able to manage the condition, that is where my role, that is where I come in. And I want to speak about the process of referral to the nutritionist to somebody having diagnosed with diabetes. And the first healthcare worker or healthcare practitioner which this individual might interface or meet with may be the one to do the referral to the nutritionist. So let's say, for example, this patient sees the physician or the doctor. That physician will in turn refer the patient. If it is that the person had the first encounter with the nurse, then the referral would be made. Or sometimes you find in cases where the patient came in with a sore, an ulcer that needed to be dressed, and even the workers right there would say, well, this person's blood sugar is abnormally high, and that person would need referral to see the nutritionist. So that is the first point of contact and the process of referral. Secondly, when that person comes and sits with me as the nutritionist or any other nutrition officer or other health practitioner as it relates to nutrition, an assessment of the patient is made. So because I do not know what are your eating habits, and that will have to be discovered when the process of assessment is being done. So that person will come through what we call dietary counseling sessions. So on the first visit, an assessment is made. I need to know what are your eating habits, what are your food choices, what do you like, what do you not like, the amount of food that you eat on a daily basis, the quality of the food, the quantity, the timing of your meals. All these factors are important as it relates to diabetes care and nutrition management. So when that is done, the information is taken in, then I look back at the notes. I need to know, what do you eat for breakfast? How much do you eat for breakfast? And I will go through the process and do that with all the meals, including snacks, healthy or unhealthy. So that would give a determination as to where we move on with the person. And the other thing about it is, with nutrition care, as it relates to diabetes, it is not a one size fits all. It has to be an individualized plan, because we generally may tend to eat similar foods, but the effects the food have on our bodies, especially when a person develops diabetes, is different. So when that assessment or after that assessment is done, then we go back. I go back into all what the patient would have told me, whether it's through a 24-hour recall, meaning you recalling all the foods you would have eaten within a 24-hour period, or we do what we call maybe on another visit a 7-day diary recall as it relates to your food, what you would have eaten within a 7 day. But when the patient comes on the first contact, I do a 24-hour recall.
Talia, just a question for you before you go on. Do you find that when your clients come in and you ask them to do that recall, do you find that they are usually very open in terms of giving you all the information as it relates to their food intake? Or does it take a while for them to, begin to trust you and then to give you all of that information?
Well, in my experience, it differs. Sometimes some patients are very, very open. They are very open and would gladly, list out the foods they eat, their dietary habits. Some can be very honest and say, Miss, I eat cake or I drink soft drinks and so on. But in other cases, you find some would be reluctant, and that is where the nutritional counseling skills will come into play, where I have to probe and maybe ask the question in the same question, but in a different manner to be able to get the information that I want. But it varies for. Sometimes they're open, and other times you find, hey, wait a minute, something is not adding up there. All right, so
Oh,
yes, it's a mix of
wonderful.
responses, yes.
So I hope that our listeners will take in that information and realize that it's very important to just be open about it because you're trying to get help for yourself.
Yes, definitely. They need to open up and say exactly what they're eating. And we do not do it in any judgmental way. You are free, and then I think I have reached that stage to be able to make the patient comfortable enough to be able to confide in me so that the information that is shared, it is not shared it is confidential. In as much as your
Wonderful.
eating habit, that is confidential. And that's supposed to be on every level for every profession. Yes. The patient provides the information, whether it has to do with the eating as it relates to the breakfast, the lunch, the different meals, even some lifestyle habits in terms of, let's say, the patient might be a smoker, or the patient might be sedentary or not exercising, or a number of questions are asked, as much as including how much water do we drink in a day. Even sleep is important. Do you sleep adequately? Because all these factors would impact somebody's health outcome as it relates to diabetes management and managing it very well. So after the assessment is done, we go back and together with the patient and to try and go through and see what it is that the patient is lacking in terms of nutrition, the food, what it is that the patient has too much of. And let me hasten to say, with diabetes management and care as it relates to nutrition, the nutrient of concern is carbohydrates. And in our terms, you'll hear the patient say the starch, the sugary foods, right? The staples, as we say. These foods are the foods that would influence or impact somebody's blood sugar. Because when these foods are eaten, so you think about, when you talk about the staples, you speak about bread, you speak about cereals, you speak about the ground provisions like breadfruit and potato and yam and pasta and rice. Juice is part of that. Our fruits, our vegetables, they do contain carbohydrates. So all of these foods would impact somebody's blood sugar. So that is where we would have that eye to see whether the patient is taking in too much carbohydrate in a day and whether they're lacking in, let's say, protein, let's say the peas and the beans and the nuts, or let's say the meats and so on. So that is where we get that information in order to be able to provide a sort of balance to the patient. Now, in some cases, some persons, especially when you're dealing with maybe the elderly, you want them to understand what you're telling them. So sometimes you have to show pictures. You would have to draw the plate. Well, this is in my instance, to show them that, hey, this is the piece of provision that you need to have, the piece of dashing, or the piece of potato, or piece of breadfruit. And this is the amount of peas. So if they can understand a pot spoon, then that is what that is explained to them. Instead of saying half a cup. And generally, how do I relate half a cup? But if you say a pot spoon, or the spoon that you eat with, maybe three of that would be a portion of peas, for example. So we try as much as possible to be able to explain to the patient exactly what needs to be done. And a plan is developed out of that. So, and it is not done at the first visit, there are follow-up visits. So if it is that at the first visit, all we need to do is to do the assessment, being able to lay a foundation for the patient to say, hey, I think I can manage to use less sugar in my tea. I think I can manage to, if the person was somebody that needed light soft drinks, there are times just taking it away at one point is not going to help the situation. So it becomes a gradual process. Now, in cases of emergency, for patient's blood sugar is 500, for heaven's sake, that is when we'll say, okay, definitely the something has to go, because that is, emergency case here. But in other cases, sometimes it's difficult for the patient to detach or disaccustom themselves to the habits, because habits develop over time. Eating habits. This is what I'm accustomed to eating. This is what my mother fed me, and this is what I'm eating. So it is difficult. So that is where it takes a step by step process.
Okay, I have another question for you, Fadia. You mentioned the follow-up visits. So I was wondering if you could explain to the listeners how you go about getting the clients to come in for follow-up visits. Is it that you call them, and now that and since we have had that COVID situation, do you provide, for example, follow-up visits via telephone or other virtual means that would make it unnecessary for the client to actually come into the community wellness center, particularly for those who may not be very mobile or those who just are fearful of being out in a COVID environment and so on.
Okay, well, in terms of follow-up visits, it takes on a number of ways. And especially as you mentioned with the COVID situation, I have done a few what we call telenutrition or telemedicine conferencing as it relates to calling up the patient. But I find some of the patients, there are challenges in that there are some physical assessment that has to be done, and it can be done if a home visit is arranged as well. So I can go to the patient's home in order to be able to do, let's say, the measurements of the weight, the height, to do the body mass index and all of that. But I have tried the tele nutrition. It has worked. Some patients just like to come in the health center setting. Yes, despite the COVID situation, some would want to come and have the face-to-face interaction. Of
No.
course, following the COVID-19 protocols.
Yes.
So it takes a number. So home visits can be done, the telenutrition or telemedicine, and of course the face-to-face. So when the patient comes in for the follow-up visit, a review will be done. So what we would have discussed at the first or the first encounter is discussed, and but at the end of the first visit, there are certain goals that are set, right? And these goals are set together with the patient. What is it that you can do? And as counselors, it is not good to force anything on a patient. They have to be willing to be able, because when it is forced, it would seem as if they're doing it for you, the health practitioner. But you have to show them, give them that sort of direction to show them that it is for their own benefit and for their own good. So when it comes out of them, I feel they have a greater sense of responsibility to be able to do what they say they would do. So goals are set. So at the follow-up visit, we would review those goals and see how much of those goals were achieved. Yeah.
Great. So in a sense it really depends on what type of follow-up is required for each individual client. So
Yeah.
as you mentioned, you said the weight and so on may have to be monitored. So there are clients who, because they would need to be weighed, you would need them to come in, or if they are unable to weigh themselves, you would need them to come in. And as you said, it depends on what they need in terms of follow-up and what their own preferences are. So I would just like the listeners to be aware that there are very many options. And as we always say, it's important to have a good dialogue with the healthcare provider. So as you can see, Fadia is very open to using other methods, so that you don't feel forced to stick to one particular way of getting your nutritional follow-up and counseling.
Definitely. Definitely.
So, Fadia, you also mentioned your older clients. So, I was wondering, in terms of the type of clientele that you get, do you think it is a true reflection of the age range of those people living with diabetes? And would you say that you have a fair number of men accessing your that service?
Okay, so as it relates to the clientele and even the age group, you would find the older adults access the services. And in terms of gender, you would find more females access the service as compared to the males. It is usually a challenge for the males in particular to access the service. Yes, some of them they do come in, but generally more females would access the service. And for whatever reason, the males stay away or they shy away. But I would want to encourage the males to come in and to maybe just do a general checkup as it relates to checking your blood pressure or the blood sugar. Or you can come in if you really want to see the nutritionist. Come in and get an assessment of your weight, your height. We have this scale that actually gives you your body mass index. That is an indication of your height in relation to your weight in terms of body fat. Then you get your muscle mass done. And I have this most recent piece of technology, the scale, where it actually gives you your body age. Yes. So there are
It's very interesting.
there are tools that we use to actually help us in, assessing the patients further. So I encourage the male counterpart to come in and access the service.
Okay, so Fadia, we have been speaking a lot about those who have been diagnosed, particularly recently diagnosed diabetes patients. And I'm happy that you said that the service is accessible to those who may not have been diagnosed. We also know that we have a problem with overweight and obesity in St. Lucia, and that is one of the risk factors for diabetes, as we are all aware. So, if we have people out there who just really they have not gone in to get their blood sugar checked in a while, they're concerned that maybe because they are overweight or obese, their risk for developing diabetes is very high. Would that person be able to walk in and access the service, or do they need to follow a particular procedure in terms of getting to see a nutrition officer or nutritionist?
Okay, well, in terms of accessing the service again, Fawn, it is open, but in some instances, an appointment would be a better thing. So the person who is interested, let's say, want to do some weight management, can come in, maybe come in, make an appointment, then, just sometimes walking in might not be the better option because I probably might be busy at the time with another patient and that individual might have to wait, right? So it would be better for an appointment to be made. So I know then that I am expecting this person to come in and to be able to provide that sort of service. So an appointment can be made. The health center can be called. Whichever location that person is coming from, called and to set up an appointment with either the nutritionist or the nutrition area. Sorry, nutrition officer for that area. Yeah.
Okay. So if that person, in other words, you were saying if the person wants to come in, call the health center, make an appointment, right?
Yes. That's
Okay, great.
nice.
In terms of dealing with your clients, what are some of the challenges that you encounter, Fadia, in terms of helping your clients? Because, I have been on the ground myself and working with and, engaging with some diabetic patients. And I find many times they seem some of them seem to be a little bit defeated, and they seem to have given up and think that nothing is really going as it should. So in your counseling sessions, what are some of the challenges you get? What are some of the challenges that come up, and how do you deal with a client who seems to feel very defeated, particularly people who have been living with the condition for a long time? And some of them, the blood sugar never seems to be stabilized.
Okay, so in terms of challenges as it relates to follow-up and nutrition services and counseling, adherence or compliance is one of the greatest challenge as far as um, the nutrition service and follow-up is concerned. Some persons may not necessarily follow through and would, I mean, for a number of reasons, they might not want to be guided or follow through the goals they themselves would have set. So, compliance and adherence to the nutrition guidance is one of the greatest challenges.
So when
Also,
we say compliance and adherence, basically we mean that the client may come in and speak with you and say, okay, within the period between this appointment and the next, I intend to have half a loaf for breakfast instead of a whole loaf. I intend to make half my plate vegetables at lunchtime 3 times a week, or whatever the case may be. But at the end of the day, they don't do it.
yes.
So
Yes, so you gave a practical example, and they may have legitimate reasons for not complying, but yes, sometimes remember when I started the conversation, I said sometimes persons may come at different stages and what we call the health belief model in terms of whether the person is still at the denial stage. So that person may have gone through nutrition counseling, the services provided, but still they might still be at the denial stage and find that it is difficult to adhere or comply to whatever information that is given. So that is where we have to go back again, and you're asking about how am I able to you know um, counteract the challenges. So there are times you might have to go way back to square one and start over again with that client and see at which stage the client is. So if it is denial, if it is acceptance, and there are different stages of the model that we go through and to see where the patient is at. Sometimes we might just have to give the patient, they might tell you, I'm not ready to go through this. But me, as the practitioner, would say, okay, let us see. Let us just concentrate on maybe one thing. Within that period of time, that 2 week period, let us concentrate on just one aspect of the nutrition guidance. If it is that you can just cut down your sugar intake by maybe a teaspoon for the day, let us work on that. And we do it bite size by bite size. Instead of, sometimes the person might find it is very overwhelming to be able to make all these years of lifestyle overnight. This cannot happen. So that is why we can deal with one situation at a time. So this is one of the ways we can counteract some of the challenges as it relates to clients living with diabetes.
I'm glad you said that because another issue that comes up very frequently is that I've heard clients say they do not have access to the healthy foods. So in the interim, if you have a client who is adamant, that person is just saying to you, you know what, I cannot get vegetables, I cannot afford vegetables. In other words, they should still come and try to discuss with you, and you may be able to guide them in spite of the fact that they may not have access, the type of access that they would like to vegetables, for example, that there are other things that they can do in the meantime, in the interim, to help their situation, right?
Definitely, definitely. So even in terms of okay, and this is another challenge that is seen quite often in terms of the cost of the food. So some persons might tell you the vegetables are quite expensive or the fruits are quite expensive. But okay, all that has been placed aside, I would tell the patient, okay, let us see some of the things that you can do that do not require cost or do not require money. Cutting back on sugar doesn't add to cost. Cutting back on maybe the ground provisions that you're eating that may be in excess doesn't come with a cost. Cutting back on X, Y, and Z. Increasing your fluid or water intake doesn't come. So we can look at these aspects as well first, lay that foundation, and then move into the nitty gritties, as we say, in terms of the portions of your vegetables, the portions of your fruits, the portions of your peas and beans. And the amazing thing about it, as you spoke of the vegetables, the grouping of vegetables to contain different kinds of vegetables. So whether it's the leaves, whether it's spinach, the zapina, the green papaya, and some of these things come free. You know, I always tell patients, go around your backyard, see what you have. See the spinach that is lacing on your fence or the zepinas and the dashing leaves. All these count as vegetables and not necessarily just the carrots and tomatoes and cucumbers. But there are a variety that you can choose from and still end up eating a healthy, balanced, and well portioned and nutrient dense meal.
Wonderful. I think that's an excellent note to end on. Thank you, Fadia. I think all our listeners, it should be very clear to them now what the service is all about, and to realize that there is a lot to be gained from accessing the service. So for our clients who are out there who have not yet accessed the nutrition services, please feel free to call the health center, or anytime you go to the health center, you can ask any one of the health providers. It could be the attendant, the community health aide, the nurse. Ask them, when will the nutritionist be there? And if you would like to access the service, then they can set up an appointment for you. So, Fadia, thank you so much for coming in today. As always, we appreciate your contribution, and keep on doing the excellent work that you are doing within the community. I guess now, Louisa,
Thank you, Fawn. Thank you very much.
you may have some notices to share with the public.
Of course. Let me just say one of the things that I want to say is the vaccination drive. Don't forget, we continue having our vaccines. Sufre Hospital on Mondays and Fridays. And you can call your nearest wellness centers to find out what days that they're offering the vaccine. I know on Wednesday it's Eaton's Wellness Center. On Friday it's Lafag Wellness Center. Also on the 17th
They'll be offering it at Fongejac Wellness Center. We want persons in the community to come out in their numbers. They'll be offering both vaccines, the Pfizer as well as the AstraZeneca vaccine. If persons really want to come out in that community, feel they have any medical conditions or they're not sure, feel free to come and speak to your nurse at your wellness center, at the Fongejac Wellness Center, or seek advice from your doctor or general practitioner, or whoever you feel comfortable with, a medical professional. Seek advice from them, and then based on that, you can make a decision whether you want to take the vaccine or not. The decision is yours. Nobody's pressuring anybody to take the vaccine, but we welcome persons, residents from Fongejac to come out in numbers to take the vaccine. Sorry about that. I also want to say a little in Creole based on what was said to our residents from what Fadia was saying. So, ça, Madame la Tekadia, Maze Fadia Tekadia, c'est pour un service là, en disant c'est l'hôpital là, en disant c'est health center, où ça fait appointment. Et puis, c'est CHA, c'est attendance là. Et puis, baissant les ça, il y a sa guide ou manière pour manger bien, manière pour contrôle, puis ça do fruit, nutrition, pour ça ou ka manger, ça ou ka boire, et puis ça ou ni pour faire. So, nous ka demander aussi pour un chay nom, ti penny diabetes, sugar, pour venir health center, vin parler by ces nutritionnistes là, find out qui ça ou ça fait, qui ça ou ça manger pour ça contrôle puis ça dou et nous savent plus femmes qui venir en dedans ces wellness center, c'est pour ça nous commander ces noms là parce que nous savons ça fait une maladie pour femmes tout seul et nous encourager ces noms là pour venir en dedans ces health center. Et puis ça Miss Fadia Tekadia, c'est nous savons changement pas qu'à venir en de yon jour et puis yo là pour ni patience là pour travailler pour ça faire l'idée pour accepter changement et pour continuer qu'à faire changement pour ça vivre et puis ça dou et pour ça contrôle sugar level. So nous demander tout le monde try as much as possible pour couiller health center qui plus près pour faire appointment et puis nutritionniste expressement sous panistique ou under control et pour garder pour santé ou qui plus important en la vie. So fun, having said that, that's all I have to say for now.
Thank you for that wonderful Creole summary.
I tried my best.
That's great.
It was much needed and much appreciated. So nous ka espérer qu'on Louisa dit, nous ka espérer tout ces monde là pour venir. Il a des autres qui manière bail là, venir en health center, venir garder pour santé ou là ni pour faire ek malade sick là, ça nous ka crier diabetes. So thank you again to our listeners and thank you to Fadia. We
and
cannot
also Lindsay for
our
joining us.
gratitude.
Yes.
And also thank you to you, Fawn.
Thank you to you, Fawn, and thank you for the collaboration.
I'd like to say good morning to our viewers on Facebook. Good morning to you, Ian, Margot, Estefani, and Hope. Thank you all for joining in. This has been Casualty 911. Until next time, goodbye